Welcome back. It is time for Morning Rounds.
That's right. So we've all heard about the coronavirus, but now scientists are now finding new variants. Christie Clinic's Chief Medical Officer, Dr. William Pierce, joins us live via video chat this morning to explain what you need to know. Good morning, Doctor. How are we doing today?
Good. Good morning, McLeod. Good morning,
Excellent.
Christie.
Morning.
Excellent. So talking about some of those variants, can we just start off explaining what that is?
Sure. All viruses regularly mutate or change, and they're called variants and various things as they go through a process. No different for the SAR-2 virus or COVID virus. It does mutate.
And how do these variants start to begin with?
They start out as the virus is replicating. Sometimes there's a mistake or something happens and there's a difference in the virus actually. Most of them are silent and don't cause an issue, but sometimes there's some variants that stick around a little bit longer.
And doctor, just as soon as we heard about the vaccination, I feel like we heard about some of these different strains as well. How many strains or variants are out there when it comes to COVID-19?
Yeah, some of the ones that we're watching, one's called B117 or P1 that's being found in various countries, the UK, in other areas. And so the CDC is monitoring these. These are ones that are sticking around, and we're watching those closely. They have been found in the United States in small areas.
And what should we really be aware of when it comes to these variants?
Yeah, with the variants, there's a lot of concern. Certainly, the variant that we're seeing now will spread more easily. It's transmitted quickly, but there's no evidence that it causes a more severe illness or any increase in risk of death. So that's a key thing to understand. And sometimes we're afraid that these may evade the testing and not be picked up. But the testing that we're doing now, the PCR, has multiple targets, so it's able to pick these variants up at this point. Also, another concern is the vaccine. Maybe the vaccine's not going to work on these variants, but the vaccine that the FDA has authorized right now are called multi-polyclonal, which means that they attack various areas on the virus. And so there's a redundancy there and a very good chance that we're not going to see any problem with the vaccines moving forward.
And then talking about some of those vaccines right now, I know that right now we're trying to get it out in different tiers. Is this going to affect how doctors administer those vaccines in the future?
What we'll do is stay in touch with the CDC, and as vaccines come out, we'll certainly administer those in priority for the safety of the patients. And one of the things that the CDC is doing now, starting in November, they really launched a national strain surveillance program. And as this month goes forward, all states will be reporting to the CDC each at least 10 samples so that we can understand what's happening with those strains and variants.
And Dr. Pierce, is there anything else that we can do to stop the spread of these new variants that we're seeing?
Yeah, I think the key thing to do is what we've seen in the past and what's working is to be able to follow the public health guidelines that we're keeping safe distance, we're using masks, we're washing hands, and quarantine when necessary. Those are the things that help with all viruses and certainly are working for us in this mode while we're waiting for the vaccines to take full effect.
And doctor, what kind of feeling is it right now? I know that we have a vaccine out there, and what kind of feeling is it to have that going on along with these new variants popping up? I'm assuming it's kind of a frustrating feeling at this point.
It can be frustrating, but as you look at the science, the vaccine is again going to be able to handle these variants. The nice thing about it is that the scientists are staying ahead of it. And so these are slow changes that happen, and we'll be able to stay up with the vaccines to cover the variants.
And Dr. Pierce, you've been talking about the CDC as we've been having this conversation this morning, and I know a lot of things have been changing over the past year. So would you still recommend that the CDC is the best place to go if anybody has any other questions?
It is the best place to go. And also our Champaign-Urbana Public Health website is an excellent source. I think the primary source understanding of what's going on is key because there's a lot of confusion out there.
And doctor, what kind of reaction are you getting from patients at this point when they're talking about these variants right now? Are they concerned that, the coronavirus vaccine that they might be receiving in those 2 doses might not work?
Yeah, there's some concern out there, and I think that's fueled by some of the reporting out there. But again, that's why we're having this discussion today, is that the vaccine is working. It's going to work on those variants. We've seen no increase of it not working. And again, these mutants are very slow moving, so there is a huge development out there looking at this and able to move and follow that variant. So I am very, very encouraged. We have the vaccine, it's working. All viruses mutate. We understand that, so science is on it.
Awesome. Dr. Pierce, thank you so much for your time this morning. We appreciate it.
Hey, thank you guys very much for having us.
Have a great Tuesday. Jack has your forecast next. We'll be right back.